And open the meeting of the Pajaro Valley Healthcare District Board of Directors at 7:06 p.m. for Wednesday, March 25th. Rosie, whenever you can, please give us a roll call.
Yeah. Director Valley? Here. Director Bill? Yes. Director Gallagher?
Here.
Director Minkoff?
Here.
Attorney?
Here. We had no closed session for the meeting of the healthcare district board of directors. So we'll move on to any agenda modifications for consideration from staff. Okay. Seeing none, I will move us on to the public comment on matters not on tonight's agenda. Anyone wishing to speak on matters not on tonight's agenda, please raise your hand online. Go online first. Okay, seeing no hands raised, anyone in person? Okay, seeing none, I'll close down the public comment for matters not on the agenda, and I will bring comments to our board members. Any comments from the board before we go into our consent items? Okay, seeing none, I will move us on to the consent calendar. I believe we have five items on tonight's consent calendar. Item number 1 is a minutes approval for February 25, for our February 25th, 2026 meeting. Item number 2 is a chief financial officer, February 2026 finance performance update. Item number 3 is the Pajaro Valley Healthcare District and Pajaro Valley Healthcare District Hospital Corporation consolidated audit report. Number 5 is the Pajaro Valley Healthcare District project update. And number 4, excuse me, and number 5 is the Pajaro Valley Healthcare District Board Resolution prohibiting the use of non-public district-owned facilities for civil immigration enforcement activities. Any questions on either of these items from the board or staff? If there are none, I'll go out to, I do have some questions. I'll go out to the public to see if there are any comments on these items. So I will entertain public comment on the consent calendar. Anyone wishing to speak on either of these items, 1 through 5, if you're online and wish to speak on these items, please raise your hand. Okay, seeing none, I will bring it to our folks in person. Anyone wishing to speak on these items? Okay, I'll bring it back to the board now for any questions, comments, and for an appropriate motion. And I do have a question about item number 5. Any other questions from the board at this time? My question for item number 5, and I want to bring up the resolution that's before the board today, and apologies for not having it directly in front of me, is thank you. I had a question in the 4th whereas, and this might be a question for council for Sam.
Sam might be able to help us.
Yeah, for Sam, thanks for being on. I believe it's the 4th whereas. It's whereas the use of non-public areas of district-owned facilities. And just that opening statement, I want to, in a practical sense, how are we interpreting that? How can that be interpreted in terms of non-public areas? Because we do have, I would say, an easement that goes through the hospital, but I don't know if that's non-public and that is considered a part of the hospital campus where cars drive through to the main entrance and can get around through the ER. If that's still considered a recognized easement, or is that a part of the hospital campus and would be off limits for staging, or what would be off limits? Sam, did that gibberish make any sense as a question?
Yeah, so good evening, everyone. I guess I can just talk a little bit about what makes an area non-public versus public. And then we can get into your specific question. Unfortunately, there isn't a black and white answer like most legal concepts. The kind of general rule of thumb is you want to keep in mind where the public is just able to access it without any sort of barriers versus areas where they're closed off or restricted. So for example, public areas will be plazas, courtyards, waiting rooms, those type of areas where anyone from the street can just walk in. Those aren't areas that are able to be, restricted for use. On the other hand, think of places like patient rooms or any sort of offices that are behind a locked door where you need a key card to access. Those are those non-public areas. And non-public areas even extend to, think of when you're in a waiting room, there's a front desk, anything behind the desk that's roped off, that's the sort of barrier that creates a space between a public area and a non-public area. So if you have, areas you're concerned about that you want, that are of concern to the district, it helps to put up signs explaining that unauthorized access isn't allowed. This area is closed to the public, employees only. Any sort of, roping off of a hallway, will also designate it as being non-public versus public. Unfortunately, I'm not familiar with the specific area you're talking about with the easement going through.
Right.
But I guess if it's an area where, if I were visiting and I could just walk across it, then I would be thinking of that as a public area. If it's an area where it's closed off in any way, I need to get approval for someone to go in that area, then that's a non-public area. So it doesn't necessarily depend on if it's an easement or, the district owns it, in a different way, has the rights over it in a different way. It's more of how is the public accessing that area that kind of determines if it's non-public versus public.
Well, I think that interpretation is fairly concerning. I think the idea behind the resolution is, we have a large parking lot. That would be, I would think, one of the ideal areas for staging, if there was a mass enforcement of immigration. And so I don't know if there is additional language that we can add into this resolution. And I'm not sure if we can actually make those edits and move forward on this, in a timely fashion tonight, and without having, again, going through legal counsel to help us rewrite this. But this is, I think that for me is concerning. It doesn't live up to, the intent of, I suppose, the resolution that we're putting before the board, and, standing in solidarity with our immigrant population that we serve every day. So Yeah.
This was brought up when it was being drafted initially too, and Noel gave input on some of that, and not to, one of the things was to have, the particulars be recommended to keep out of the resolution and leave with the policy level that the CEO can create. That was, not that I'm saying that's what we should do, I'm just saying that was what was recommended from Noel previously, because it was brought up as a concern as for parking lots and public space, because that was where I was thinking when we came up with it. So I don't know if that would be something, Steve, I'm uncertain how that would look or what that would be, but this would be the overarching piece from us, and then it would be left to, I don't know, that doesn't necessarily make it better, but.
Right. Joe, please.
My question is, Sam, can what's currently a public area be converted to non-public
That's what I was gonna
by a
ask.
simple barrier that is monitored for access? We have this big parking lot area, and then what runs in front of the hospital could be called a driveway that is 2 lanes wide and surrounds the hospital. You can go in one way and out another. Could that be converted to non-public?
Yeah, so to answer your question, a public area could be converted to non-public. I guess kind of the nuance there is with an area like a parking lot, it is a little bit trickier because that is kind of typically open for public access. So if, the district was, trying to convert it to some sort of non-public area, we would have to kind of look into that further and see if there is a creative solution there. But in general, yeah, you can, if there's a hallway that doesn't have any barriers and you put up a sign that says, employees only, that switches it from a public to a non-public area. So that concept could be applied. It would just something that we have to look into?
Yeah, something as simple as a sign, Sam, that says, only for employees of the hospital or patients for the use of the parking lot. I don't know if that would, give it additional, I guess, legal protection or give our district and our hospital, some legal teeth if it is used in ways that the essence of this resolution is against the intent of this resolution. I suppose that's what I'm asking. Like, what's the best approach to do that? With how the resolution is currently written.
And is that a part of the policy piece that then could just be?
Yeah, so if this resolution were to be passed, I guess in order to address your concern, the critical thing would be trying to turn the parking lot into a non-public area, which will then cause it to fall within this resolution as it's currently written. So this resolution could be passed as it is written now. And if there is a way to make the parking lot a non-public area, it would still fall within this. Does that make sense?
Yeah, I guess my next question is for Steve is what is, I guess I park here so many times. I've never looked at the signs that are around that say staff, no staff, public, or what is open to the public. And because I know it's a healthcare campus, right?
Right.
So PV, health trusts, and something about the employees are here, hospice, so on and so forth. It's open to them to park. So I don't know.
Well, as Sam mentioned, there are no black and white here, right? There's lots of shades of different colors, and so the conversation that I had with council about this was related to those. We did talk about the parking lots, as Alex mentioned. And I said, well, we do have security who rounds,
right.
And if they see somebody in the parking lot that looks like they're just hanging out, they're just loitering, they're organizing, gathering, whatever it might be, security is asking them, like, do you have business here at the hospital or in one of the medical office buildings? And if the answer is no, security asks them to move on. So that would be we would continue to do that as a security policy. And if that were theoretically a federal agency that was trying to sort of gather and conduct business, that will be in line with our policy to ask them to move and to cite this policy and resolution. And we all know that they may or may not comply, right? But it would be consistent with what we do with other people who are just kind of hanging out, parked, not having an actual business here on the property, which I think puts it in a little bit of a gray area. Does that make it public or does that make it private to the use of the facilities that are here? I don't know that helps with the resolution, but that's the conversation.
Dr. Gallagher?
For me, context is influenced by Minneapolis.
Yeah.
It was not cordial, to say the least. And so as strongest as we can, because there's a possibility that it would be challenged, et cetera, by both sides. And so as tightly and powerfully as it can be worded, I'd hate to be in your shoes to be walking out to ICE agents to say, our policy is that you can't be here.
Yeah.
Please move along.
Yeah.
I'd like something stronger than that.
I don't know that there is anything stronger. I think that's part of the challenge here, and Sam can help correct that if that's wrong.
Yeah, I mean, it's tricky because kind of like keep coming back to it is a lot of gray area, and even with the suggestion of could we create a non-public area by consistently asking people, to leave, move along, that's something we would have to look into further, and I would anticipate that the answer would, even within that situation, be it depends. So it's just kind of trying to, the district trying to do its best to, create a policy that, within this gray area, it's a little tricky.
Okay, we do have to take public comment for this, so I think it's a good idea to go out to the public, and then come back to the board for additional discussion and questions and comments if we do have them. So thanks, Sam. We'll come right back. Do we have anyone wishing to speak on this item? And this is the part of the consent calendar, so this would be, I believe I already took public comment for this, didn't I?
So it's being discussed, we're going to pull it out into the discussion agenda and put it at the end.
So how about we, as a board now, since I took public comment for the consent calendar, that we vote on items 1 through 4. And then we come back for additional discussion on item number 5 that's been pulled from the consent calendar. Since I've already taken public comment, do we have any, do we have an appropriate motion for consent calendar items number 1 through 4?
I move to pass consent items 1 through 4.
Can I get a second?
One second.
Thank you.
Thank you, Directors Friel and Valley. I'll take roll on this item. Director Valley? Yes. Director Friel?
Yes.
Director Gallagher?
Yes.
Director Pimentel?
Yes.
I'm sure.
Yes. Okay, so item number 5, any additional questions or deliberation from the board?
I have an afterthought out the other side of my mouth. I think going out to say move, they move across the street to the airport and set up over there. And yes, they're off our property, et cetera, but there's plenty of other space and there's other whatever. So maybe it doesn't need to be as rock solid as even a gesture in that direction is acceptable. This is my follow-up thought.
Any other comments or questions?
Just a comment, I trust our peer agencies who are also looking at this, are gonna, we're gonna all learn from each other. That's ways to improve ourselves. So I think I feel confident that this is a good first start. It's a strong first start. It sets the tone of why we're here and what we're valuing. So I'm ready to move. In fact, I'll move approval of the resolution as recommended.
To that point, the verbiage was templated from the Watsonville resolution.
Second.
You, Director Pimentel and Gallagher, I'll take roll on this item. Director Valley?
Yes.
Director Friel?
Yes.
Director Gallagher?
Yes.
Director Pimentel?
Yes.
I'm sure.
Yes, I'll just add on here that at a future meeting, if we can have an update about what we would like to do, what are the potential things that we can do to further make our parking lot more restrictive to the use of that. And I understand that some of those restrictions might impact some of our unhoused members of our community that might be receiving service here and those sorts of things. But I think that for the sensitivity of this item, I think it would be good for us to receive a report about what steps we're taking and what sort of policy we can put in place to follow the essence of this resolution. I know that the County of Santa Cruz, they're looking into potential, and it was discussed among their board of having it be civil infractions as well. So thinking about, they can't forcibly remove, right, potential federal immigration officers, but can ticket the heck out of them until, right? So taking any sort of steps to essentially deter that sort of action and those sorts of things happening within the county and their county, property, and the same thing. I think we should do that as well and strengthen it as much as we can. So.
Yeah, I agree with that, and even maybe a minimum of signage of some sort that just says patients and staff, and visitor staff, something that's very specific to general and specific at the same time. So.
Could you put the new logo on it?
Welcoming to the correct people.
Okay, thank you. So we'll now move on to item number 6. And this is item number 6 is the external partnerships update. And it says the contact here is Steve Craig. Steve?
Yeah, I think that our ad hoc committee will probably do most of the report here, but just as a brief reminder for everybody, we have been engaged really since HR 1 passed. The board and leadership came together to talk about what the future of our hospital and healthcare district looked like, and the knowledge and understanding that with all of the federal cuts that are already started and are continuing to pile up over the coming years, that making it on our own as an independent healthcare district was going to continue to be challenging and more challenging. And so let's continue to engage and re-engage with local nonprofit, regional healthcare systems, community government agencies that also provide healthcare. And how can we partner to move forward together to strengthen our services, to bring more physicians here, bring more services, take care of more patients here where they live, rather than them having to go elsewhere, and create a more financially sustainable model for our hospital and our healthcare district. And so we've been doing that. I want to thank Director Friel and Chair Nunez for, I think we can now say dozens of meeting as the ad hoc committee. They have been working really hard on all of this, and so I appreciate that. And I'll let you kind of give the, obviously, we don't have any action items for today, but we do, just some sort of procedural updates on where we're at.
Yeah, so as Steve said, we've been meeting, and yes, I think we can safely say dozens now, dozens of times since the ad hoc committee was first established in Q3 of 2025. This update is going to be a verbal update from the board of the progress that we've been able to make and where we're at in the process. So for tonight, unfortunately, we don't have something coming to the board for approval or for review yet. Although the discussions that we've had with potential local partners, the variety that Steve talked about, regional healthcare providers already providing healthcare in this region in Northern California, have been going very well. What I can say is that over our dozens of meetings with the ad hoc committee, we have continued to remain focused on the guiding principles that our staff and that our board approved when we first brought the guiding principles back and gave them a refresh from the first request for proposals that we sent out back in 2024. Those guiding principles focus on the commitment to the people of the Pajaro Valley, to our staff, to the preservation of jobs, and to maintaining the district's property ownership of the campus that we were just talking about recently, right now, and of course of strengthening healthcare services across the entire region. Our CEO over the last few months really has written multiple times in local newspapers about the work that we've been doing and why a partnership is needed. And so I want to thank Steve for continuing to move that conversation forward within the public landscape. And we've gotten good input from our community partners about that. And the interest continues to remain high because they know what we know, which is, this has been 2025 was a very difficult year for us. And we know that we need to move quickly here so that, we can find a partner that will allow us to have a bounce back 2026. I think the good news is some of the progress that we've heard so far so far in this meeting and our hospital meeting is that operationally, and I know that Director Pimentel talked about this in his comments, operationally we're doing well. But the need for a partnership continues to be there for the hospital and the healthcare district. And so we've had conversations in the ad hoc committee about continuing to double down on the need for a partnership and casting the net a little bit wider again a few meetings back, and have had good discussions with additional partners that have come back into the conversation as well. And so although we've had very good discussions with potential partners, and I remain really optimistic that we will have something to come before the board for review and for input, and then for eventually for approval. We don't have something here tonight, but we are continuing to get closer to ensuring that we follow through on the vision that the board had, and that the folks that were around the table during our strategic retreat back in August had, which is again the preservation of staff, the preservation of our healthcare services here locally, and also the expansion of healthcare within our community. So I wish I had something here that we can review and that we can give input on. I can say, as Steve said, that everyone on the ad hoc committee is working really tirelessly to get this done, and conversations have gone very well. And I hope that sometime next month, if not even sooner, that we're able to bring something for the community and before the board for potential feedback, although I can't guarantee that. One thing that we've been able to do, I think in the last presentation that we gave in January, we introduced our consultant, Zephyr, and they have been great in expanding the sort of strategies that we might employ to bring partners to the table, and also in the potential in what a potential partnership could look like. Those discussions have been very fruitful, both internally within the ad hoc committee and with other potential partners of the possibilities of being a part of a government entity like a healthcare district. And so I wish I could say more. I wish I had something for the full board to review tonight. We don't, and I feel like we're very, very close. And so, I know that the board has been very nice to us and how patient you have been in us doing this work. And I know that the staff has been waiting for something to come as well. And so I'll just take the moment now to apologize. I know I said that we would have something here tonight in March that we would be able to review, and that would be a substantial, close to an agreement. We don't have that yet, but we will hopefully soon. And discussions have been going very well. So just want to let everyone know that we understand the challenges of 2025. We understand that even though we are, in the positive through the first 2 months of 2026, that those challenges of 25 continue to linger. And we appreciate everyone's patience as we're putting together what we hope is going to be an excellent partnership opportunity for this board to review and to give input on in the next coming weeks and possibly months. So, Alex, anything you want to add to that?
Just that I also echo the apology. I really wish we were moving forward sooner, but everything goes slower than we want. And that I am coming here this month feeling very optimistic. And I think that we are on a good path. So I'm hoping to be able to share that path in April.
Okay, with that, I'll open it up to the board for any questions of the ad hoc committee or staff at this moment.
Question about, early on, one of the options wasn't necessarily a partnership as much as was an opportunity for lease space and expanding and utilizing our lease space. Getting the staff or the committee ad hoc speak to, that still a live concept? I mean, it's a little bit different than a partnership agreement that has other elements to it. Any updates on the size or the ability of leasing space?
Leasing space within the hospital campus.
Yeah.
I think we've been exploring a lot of different options. The potential, I think when we had first came to the board in August, and we started talking about, what a potential partnership could look like. And we obviously got 3 options submitted to us in the past ad hoc committee process. Everything from a management services agreement to a potential, leasing of space similar to what Kaiser, one of our current partners, submitted the last RFP. And so I think there's been a lot of, there has been good discussions about what a lease of space could look like. And at the same time, we realized that, potential partnership where a healthcare, provider or larger healthcare system can come in and provide multiple things, right? Can speed up a process of shoring up some of the weaknesses that we have as an organization. And so I think the direction that we got from the board was to go out and look for a strategic partner that can help us, not only weather the storm that is coming from HR1, but also to address some of the structural challenges that we had even before HR1 was approved, and also to expand services throughout Santa Cruz County and the Central Coast. And that's really what we've been looking towards. So although we've had conversations about potential lease of smaller areas of the space, I think, the ad hoc committee has been really focused in on a potential larger partnership that could be something that continues to improve healthcare in our community for not just the short term, but also for the long term as well. Thank you. Any other questions about? Okay, I do want to go out and get public comment on this item, even though I do not have to. Anyone online wishing to speak on item number 6, the external partnerships update? Okay, seeing no hands raised, anyone in person wishing to speak on this item? Okay, seeing no hands raised, I'll close down the public comment and I will move us on to item number 7. This is a consideration of Senate Bill 1078 support. The recommendation before us is to consider adopting resolution in support of Senate Bill 1078, a measure that would allow the County of Santa Cruz Board of Supervisors to seek voter approval for a countywide transactions and use tax above the 2% statutory cap of help offset the loss of federal funding for local programs and services. Steve, whenever you're ready.
Yeah, so you said that well, lots of words. The background on this is that the County of Santa Cruz is considering a path similar to what the County of Santa Clara recently did, which was to have a ballot measure that would raise revenue to help offset all of the losses that the federal government has taken away for health and human services. So cities, counties, states that want to keep helping people are having to fund that and help themselves to do that. And in order to do that, the county would need this Senate bill to be passed, which will allow the county, as other counties have done, to, as you said, go above that 2% cap for sales tax limits, the things that you're gonna have to ask county people about for more details on. And so other health and human services agencies have been asked to support the county in supporting this bill so that they have that opportunity to potentially raise revenue in that way.
Thank you. Any questions for staff about this item?
No questions. I just want to read. There are 2 items on today's agenda that both directly, the item later on, and this one reasonably indirectly. We're supporting a Senate bill at the state level, but it attributes to my day, my employer, my day job. So I just wanted to be ultra cautious with assuring everybody that I do not feel I have a conflict of interest either on this item or on the next item. And I'll speak with a short little statement that as the employee of the County of Santa Cruz in the position of the county budget manager, I'll self-disclose that for the purposes of our conflict of interest code under California Nonprofit Public Benefit Corporation law, I may be considered as an interested person, again, may be considered. Accordingly, I want to inform the board that it is my belief I do not have a conflict of interest related to this one, item 9, item 7, and later item 9. Within the County of Santa Cruz and with consultation with the County of Santa Cruz Legal Counsel, any county staff that may be working on items that could touch my role here on the hospital board have been instructed to exclude me from those conversations from a formal matter. So I've not been included as much as I normally would be in a sales tax revenue measure. I've been excluded from all the planning and direction of this particular ballot measure. So And that includes conversations with our independent elected position or our county auditor controller. So with respect to the two conflict of interest laws that are pertainable to us, California Fair Practices Commission, and I affirm that I do not have a conflict of interest regarding these actions, and just wanted to state that for the record. Other than that, no comments to the item.
Any comments or questions before I open up to public comment? Okay, I will open up for public comment on item number 7. Anyone wishing to speak on item number 7? Online, please raise your hand. Okay, seeing no hands raised, I'll now go over to our folks in person. Anyone wishing to speak on this item? Okay, seeing no hands raised, I will close down the public comment and bring it back to the board for additional deliberation and an appropriate motion on item number 7. Any questions? Appropriate motion.
I'll move to top for item 7 to approve. Sorry, I'll second.
Thank you, Director Freeland and Valley, I'll take roll on this item. Director Valley?
Yes.
Director Freeland?
Yes.
Director Gallagher?
Yes.
Director Cisco?
Yes.
Yes. Okay, we'll now move on to item number 8. This is consideration of Assembly Bill 2311 support. The recommendation before us is considering adopting a resolution in support of Assembly Bill 2311, a measure that would provide physicians the choice to be directly hired by a public healthcare district or by public healthcare district hospitals and nonprofit hospitals tied to healthcare districts. And Steve.
Yeah, so this is a bill that is sponsored by the Association of California Healthcare Districts, of which we are a member. So they have asked all of their members to consider supporting it as well. There are other public hospitals that are able to employ physicians for clinical work, including the UC system, as well as county hospitals. But the district hospitals and hospitals like ours that are part of healthcare districts are not. And it would give one additional tool in the toolkit, if you will, for being able to recruit physicians to our area. I would also say that, you know, a potential drawback is it does also open up more competition for recruiting physicians to the area, right? We've got a couple of healthcare districts that surround us that don't have the same financial struggles that we do. So it would add kind of a couple more players to the other players that are, you know, we compete with for physician recruitment. So I do think that it would add another tool. I know that there are other opinions on it as well, and so I put it out there and want to let the board either opine on it, ask questions, and consider the adoption.
The question from internal, have we received any feedback internally from staff or physicians within the hospital about this bill? Is there a significant portion or a portion of our physician group that would be opposed to something like this that we're aware of?
Not that I'm aware of. Like Dr. Gallagher.
Marcus, I texted Dr. Grady back and forth, and he said he was unable to stay, but the CMA's position is against direct hiring of physicians, and it's sort of different. I had asked him if he'd wanted to contact their attorney for some input, and I think time-wise, it just sort of didn't happen. I have sort of done some and have comments for whenever's the appropriate time to do that, sort of putting back my physician hat on. Yeah.
Now's a good time.
So yeah, I mean, as a doctor who's on the medical staff, I understand this issue really quite well. Medical staffs in California are independent self-governing organizations just for this reason. As physicians started to contract with hospital organizations, in my view, it's a backdoor way to control medical practice. it's sort of probably stated bluntly and clearly. Day, and so that the length of stay went outside what was the goal. All of those things were quite powerful. And so I think the crux of that is what's often best for the patient is often bad for the bottom line. And so historically, boards were the arbiter between those two sets of interest, the bottom line and patient care. That's sort of gone away for a long time, but it was thought that that was considered sort of dynamic tension between those. 33 states in the District of Columbia have some form of a bar on the corporate practice of medicine, which is directly hiring physicians. California, New York, North Carolina, and Texas have the most stringent of those laws. It's both legislation and case law. If you will, in my sort of hand system, administration and independent physicians have roughly equal, but the physicians slightly less. When physicians are part of a medical services organization where the medical services organization then contracts with the hospital, they have some protection, but slightly less. But in the situation where the physician is an employee of the hospital, their choice could be you can either sign up as an employee or you can choose to work elsewhere. And so I have over the years been surprised at how easily influenced physicians' care decisions can be by directives from administration. The whole point of employing physicians is control. The hospital has more control over pay and or how medicine's practiced, even though in the California legislative analysis says there are laws that protect the influence. The whole point is control. It's sort of not really credible to make that. The exceptions are, as Steve mentioned, the UCs are private nonprofit university medical schools, scientific and charitable organizations that do research, narcotic treatment programs, licensed charitable organizations that do only pediatric subspecialty, county hospitals and critical access hospitals. One of their comments in this analysis was that the intent of this ban on the corporate practice of medicine is to protect the independence of medical professionals and prioritize patient care over corporate interests. Further in that, there was a survey of graduating residents. 2/3 of them says they would like to work for hospitals. Farther on, 49% of the residents said they were unprepared to make business decisions. And so I would sort of invalidate that sort of perspective, saying they don't really know what they're really talking about. And there is a substantial amount of literature sort of post-COVID about moral injury as experienced by physicians who the most glaring results are not community hospitals like this one, but they are where private equity owns ERs. And it's a shocking percentage of the ERs in the country what doctors are told they can't do under those kinds of circumstances. And so this is one of those instances where I'm all for independence and not directly hiring physicians. I think Kaiser does it the right way, where Kaiser runs the hospitals and the Permanente Medical Group is the medical group. I think that's the right example to do this. The other thing that I have seen, which is what happened here in the early years of Coastal Health Partners, it's considered a medical services organization. And so there was a physician owner of the medical services organization who was really a figurehead. They were off-site, they didn't participate. The CEO basically ran the medical group in those days in a way that I think didn't comport with what the laws were in those days. So I hope my colleagues will vote no on this resolution. And I do end up with one question. I have always assumed in recent years that we are a district hospital, but whether it was from you said, no, we're still a community nonprofit hospital that is run by a district or owned by a district. Do you?
The state has us, as we are a private nonprofit hospital run and overseen by a healthcare district, but we are carved into this, the way this bill is written.
And we appear in the ACHD's stuff saying this would be ideal for Watsonville and Fountain Valley. I was surprised to see our name pop up So that's my pitch for
Yeah,
voting
I was
no
too,
on-
just
in
so-
terms of this. Yeah, well, good to know.
They're trying to help us.
Yeah, sure.
I have a question. Do we have to vote on it tonight? Is there a deadline?
I think they were hoping to get something tonight because she had originally asked all of the districts for something by like March 18th. And I said, our board meeting is until the 25th, and she said that that'll be fine. So.
Do we have any other questions or comments about this item?
I just don't feel as well informed as I thought I was now. I don't feel comfortable voting.
Well, what we can do tonight is if the board needs more information or more time, we can defer the item to a future meeting. And I know that the Association of Healthcare District was hoping that we would take action today, but we don't have to.
Yep.
Can I ask just, is there any, what's the consequence of no? You know,
Of
I
us
can't-
saying, of this board saying.
yeah, is there any perceived impact to note? I mean, I think I've implicitly heard just the competition it'll create and the underfunded hospital currently, it'll put us instantly at a disadvantage. I appreciate, Director Gallagher, your comment. I think it's spot on and we're concerned about the purpose of our district is to put care first. So anything we do that might indirectly, impact that, I'm against, so I'm just curious about it. Is there anything out there that, I guess I'm just asking the question, is there any impact that you can see from voting no on this?
I mean, we're a member of ACHD, right? They've asked all the members for, to sort of sign on as support. So I agreed that I would bring it to my board. I don't think that they will help us less in the future with our advocacy if we choose not to sign and submit a letter on behalf of this bill. That would be my only concern, but I don't think it's a concern.
Do we know how, sorry,
I think they'll understand if this is not where we want to place our advocacy hat at this moment.
yeah, and so, if we would still like to take a vote on it, obviously we would, have a first and a second to have a vote on it, and then we can vote however we would like to vote on it, and if it's a no, it's a no, if it's a yes, then it's an approval of the resolution. So currently for, the UC system and county hospitals, they've been able to employ doctors, directly.
That's my understanding, but I've never worked at one, so I don't know the ins and outs of it.
Yeah.
The little bit that's the California legislative guide said faculty or professors at the UCs are hired. That's as much as I know. I don't know if the clinical faculty is or not.
Okay.
And I don't know how it works at county hospitals or critical access hospitals.
And in the bill and the proponents of the bill, in terms of the benefits of being able to hire your own physicians, just from a physician leader standpoint, I mean, what sort of positives would that bring to a hospital, being able to have your own physicians, recruit your own physicians and have them be a employee of the hospital?
Yeah, I mean, it's one more recruitment tool to bring physicians to the community and try to keep them in the community. You've got a little bit more, like you said, not trying to use it as a bad word, Joe, but a little more control over keeping those doctors right in the community of the hospital. If they're your employee, there's
Okay,
I'll move that we reject the resolution based on largely, Director Gallagher, your commentary, just concerned that it puts us at a recruitment risk, considering our inability to offer core-based benefits to even our existing employees. How do we start that with others? So I'll move that we reject the resolution.
Second.
Okay, thank you. So yes, new motion stating in opposition. So we'll be voting for it means voting against. Voting for the motion means voting against the resolution.
Correct.
Okay, I'll take roll on that. Director Raleigh.
Yes.
Director Creel. Director Gallagher.
Yeah.
Director Pimentel.
Yes.
Chair Newman.
Yes.
Yeah.
Thank you, everyone.
Okay, we'll now move on to item number 9. This is an amendment to loan agreement with Santa Cruz County. And the recommendation is to pass a motion to approve a new loan between Powder Valley Healthcare District and the County of Santa Cruz in the amount of $240,000 to cover interest payments for the next 6 months on the $4 million line of credit with West Coast Community Bank to help district with cash flow constraints. 2, the renegotiation of payment schedule on the remaining $700,000 balance due to the county. And 3, give the signing authority to complete all relevant paperwork required to the district chief executive officer and chief financial officer. Julie.
Okay. Yes, so this is kind of 2 separate but interestingly entangled items. And both thankful to the county for their support of the hospital in looking for ways to help us. I'm going to start with the second one first, which is renegotiating the current payment schedule on the remaining $700,000. This is from the initial letter of credit that was put in place back in 2022 when the hospital was purchased out of bankruptcy. The lease agreement with MPT, because the hospital was still renting at that point, required a $2.7 million letter of credit, kind of a security deposit. It had actually at that point in time about a 6-month timeline for repayment. The county early on had identified we were unable to make that full $2.7 million payment. We had renegotiated a more extended payment. We paid off some of that. Last year, we entered into another agreement with the county that gave us some loan forgiveness in exchange for the work that was done in the ED with the pediatric stabilization program. And we were left with the last $700,000, which we have a payment timeline currently in place. They are recognizing our struggles with cash flow for all the reasons that we've been talking about this evening. And so they have offered another kind of deferred payment plan to push that out for really a couple more years. In the midst of this, as they have also been our partners in looking for other cash flow opportunities, we've talked about various things that we're challenged with, and one being that we have a $4 million line of credit. We can't afford at this point to pay that back, but we are paying interest to West Coast County Bank on that every month, and it's a fairly high interest rate because it's tied to the prime rate. So they came up and offered a solution of a smaller loan for $240,000, which is a rough estimate of 6 months worth of interest payments. The 6-month term was really about our best understanding of the QOF, when this QOF 9 could be approved and when funds could start flowing to us, because if it's approved in the summer, say by the end of June, early July, we should see funds by the 4th quarter. So we kind of tacked on that additional loan amount of $240,000 to the $700,000 and said, offering that loan to us, we would pay back that $240,000 first, but the first payment wouldn't even be due till November 30th of 26. And it would just be half then and another half 6 months later in May of 27. And then after that, getting back to that original $700,000 and scheduling that over 5 payments that starts in November of 27 and actually goes through November of 29. This is an interest-free loan to us. We are not required to put any collateral down. They have been very, very generous in how they have worked with us over this loan. And by the time it's paid off, it will be 7 years from when the loan was granted to us. So I am asking for a motion to approve that we accept this amendment as they've outlined.
Any questions for Julie for open up for public comment?
No, I'm gonna forward you again with just my opening comment. I just want to state that as an employee of the county of Santa Cruz and in the position of the county budget manager, I want to self-disclose that for the purposes of our own conflict of interest code and under the California Nonprofit Public Benefit Corporation law may be considered as an interested person. Accordingly, I wanted to inform the board that it is my belief I do not have a conflict of interest related to this item. Within the county of Santa Cruz and with consultation with the county of Santa Cruz legal counsel, any county staff that may work on agreements or other items pertaining to the hospital are to exclude me from participating in the development of those documents. And this is another example where I had no role in the discussion or deliberation or development of any documents or agreements. With respect to any other conflict of interest regulations, including the Political Reform Act or Government Code Section 1090, for the purposes of this item, as having been informed by our district's legal counsel, I would again state that I do not have a conflict of interest. Therefore, I feel I can take an action on this item.
Any questions from the board on this item? I'm gonna open up to public comment now. Anyone online wishing to speak on this item? Seeing no hands raised, anyone in person wishing to speak? Seeing none, I'll close down the public comment and I'll bring it back to the board for an appropriate motion and any additional deliberation.
For the motion as discussed in the finance committee this morning, it's going to sound weird, but express my surprise and appreciation for the county for bringing this forward. It was also grateful to see that there's no interest being attached to this loan, and there still hasn't been. So I appreciate the partnership.
Move approval. Thank you. Can I get a second?
Sorry, who's the first one?
Or Gallagher motion?
Thank you, Gallagher and Railcraft. I'll take roll on that. Director Valley? Yes. Director Fredo? Yes. Director Gallagher?
Yeah.
Director-
Yes.
Yes. Okay, that was our last item, so I will adjourn this for the night. Thank you.
Thank you.